Hi, welcome to Healthcare Hoax Videos. I'm Janet Cimorelli. I'm here with Dr. Herb Slavin, and this week we're talking about LDN, low-dose naltrexone. And I want to share this information with our viewers to let you know that Dr. Herb Slavin is available at the Institute of Advanced Medicine. And when you book your appointment at the Institute of Advanced Medicine, you can discuss the possibility that low-dose naltrexone, LDN, is appropriate for you. And you can call 954-748-4991 in South Florida to schedule your appointment with Dr. Herb Slavin and discuss low-dose naltrexone. So, continuing our conversation about low-dose naltrexone, it's what does it do? How does it work? And do most doctors know about low-dose naltrexone? So Dr. Slavin, if you're explaining to one of your patients about low-dose naltrexone, what do you tell them about how it works, what it's going to do?
Well, we had a patient just the other day, and she knew about low-dose naltrexone, and she asked her doctors, and none of them wanted to prescribe it for her. Perhaps because they really didn't know much about it, or they said, well, this is alternative, we don't do alternatives. But this is a drug that has been around for a long time. You have to obtain it from a compounding pharmacy because the original drug is 50 milligram dosage. We're talking about dosages between 1.5 and 4.5 milligrams. That's why they call it low dose. And what they have found is, in comparison to the full dose, the 50 milligrams, and by the way, when you take that for opiate blockade, you're taking 50 milligrams 3 times a day. Give you a comparison. Here we're talking about maximum 4.5 milligrams a day, taken at bedtime. So you get 1 to 2 hours where it's blocking the production of endorphins in your brain while you sleep. And then it wears off and the brain compensates by making even more endorphins. And that's what they think is the mechanism of how it works. These endorphins are effective in killing cancer cells.
So the research has been done with low-dose naltrexone, and compared to that 50 milligram dose, LDN would be between 1.5 milligrams and 4.5 milligrams. And the research pretty much shows that below 1.5 milligrams, there isn't any significant benefit, the kind of benefits that they know the research has shown to create. And over 4.5 milligrams, there doesn't seem to be any additional benefit. So how is it that how can they find out about the research? How can the patients have a conversation with their doctors or with you, Dr. Slavin, about LDN therapy?
I'm pretty sure mainstream medicine doctors are not going to be interested in this approach because that's not where their mindset is. Their mindset is prescribing prescription drugs. Although this is a prescription, you have to get it through a compounding pharmacy. It's made up, specially for an individual. And I just want to read some of the results that Dr. Bahari had. For example, with cancer, and this goes back to 2004, he had 300 patients in this study he was doing with cancer that had already failed to respond to the standard treatments. Of that group, about 50% after 4 to 6 months on low-dose naltrexone, they began to demonstrate a halt in the growth of the cancer. In other words, the tumors weren't growing anymore. And of that group, over a third began to show signs of tumor shrinkage. So that's pretty good, especially without any side effects.
It's very good without any side effects. And then when you factor in the price point aspect of it, critically important information to be sharing with our viewers here on healthcarehoaxvideos.com. And when we post our next video, we'll tell you all about why there might not necessarily be very much publicity about the LDN. So you've been watching healthcarehoaxvideos.com, and if you subscribe, then we'll send you a notification when our next video is up. Thanks for watching.